Well, welcome back to yet another subscriber Q&A. This isn't so much a subscriber question as it is just a service to our subscribers. It's a question that I'd been asked on other social media platforms over the last week or so about how I felt about social distancing, what I felt its efficacy was it going to do us any good? And the problem that I had was that I really had no hard numbers to be able to answer the questions. Obviously, this is going to vary from region to region as far as your experiences in how quickly the outbreak spreads and doubles. But we've got some hard numbers on worst case scenarios on how that happens from Italy, especially, and Wuhan itself, where the virus started. But until recently, hard data was really difficult to come by. I know a couple of people that work at local Sacramento hospitals. My sister works on the East Coast as an ICU nurse, but these people have their heads down. They are just cranking. They're just dealing with what's going on. They don't really have the time to collect any hard data. That leaves us with Dr. Gatchett. Now, Dr. Gatchett is a bariatric surgeon here in the Sacramento area that's obviously stopped doing elective procedures and then offered her services to one of our local hospitals. And one of the things that she was very interested in is in how to plan for this. How do we know when we get ourselves into a situation where we may need to call for outside help, whether that's FEMA or whether that's the National Guard setting up field hospitals, that kind of a thing. And so what concerned her was the numbers of available ICU beds in the area. And available becomes really important, and I'll go over that in just a minute. But the other thing that she noticed is that the media outlets had really zero incentive for giving you any meaningful information at all. They're just out there. They want to tell you the total number of cases that are out there. They want to tell you how many people have died. But what they don't want to mention, because it doesn't give them any benefit, is how many active cases there are. And this is something that Dr. Gatchett wanted people to spread. And so I'm hoping that you will contact your local health authorities and your local media and national media to try and make sure that they give you accurate numbers of how many current cases there are. In other words, how many people have reported the active symptoms from the virus. Now, what this allows us to do then is it allows us to then track, knowing what we know about the incubation period. It allows us to not only know how long this person is going to be infectious, obviously, and that's important for quarantining that person, but it's also critical so then we know how many people in the previous generation, the previous round of this, were infected and how many have already recovered, because that recovery number is also really important. The idea behind social distancing is to try and keep a balance where the medical professionals can keep up with the number of cases. So let's go ahead and get into some hard numbers here for the Sacramento area. Now, again, these will deliver to you some ratios that you can then use in your own communities. If you can find out how many active cases there are, or if, like you'll see in the case of the Sacramento area, if you're early enough in the outbreak that you can actually then back calculate and figure out some pretty interesting information. We'll get into that in a minute too. But Dr. Gatchett's plea again was to try and get that reporting done that actually is meaningful, as well as the number of available ICU beds in the area. So in the Sacramento area, she discovered that we have 350 beds total, spread around 9 facilities, adult facilities in the area. And of those, again, that available, that's the important key. Of those beds, 70% at any given time are occupied by other patients besides any that would be involved in this outbreak. Because the outbreak just because it happens doesn't mean that we're no longer having traffic accidents. We're no longer having people with other health conditions that then wind up having them in the ICU, whether that's a stroke or what have you. That still happens. And so consequently, of those 350 beds, there are only 105 available for other things, whether that is, again, the viral outbreak or whether it is a plane crash or some other localized disaster, a gas explosion or what have you. So it's really critical that we understand that freeboard also is dependent on other things. That freeboard was there for a reason, not just because of this viral outbreak. So with that, let's go ahead and grab your favorite beverage and let's crack into some of these numbers. What we're going to do is we're going to figure out in the Bay Area, or excuse me, in the Sacramento area, how many cases per million we could handle as a load, how many active cases total we can handle as a load and not overwhelm our healthcare system. And then hopefully that will allow you guys also to calculate the numbers in your own areas. So now let's talk about those saturation points and how quickly we might reach them. So let's not use Italy as an example again, because their number of cases was really kind of off the hook. That is a good thing to look at if we're looking at kind of a worst case scenario as far as how this goes with no social distancing and that type of a thing. But let's go ahead and take a look at New York. New York culturally more resembles Anywhere City, USA. And so let's take a look at that then. So on Friday the 20th, there were 46 cases per million people. All right. Now, by Saturday the 21st, there were 1,126 cases per million. And to put that into perspective, in the Sacramento area, we mentioned that 2,100 active case figure was our kind of saturation level for our ICU open beds. Well, that in the Sacramento area equates to 1,400 cases per million. We've got about 1.5 million people in the Sacramento area. And so that shows you how quickly this can escalate if there's no controls over it, if we're not social distancing and that kind of a thing. So with that, let's go ahead and take a look at how this all started, when this all started in the Sacramento area. I think it's kind of interesting for folks to see how quickly this built up, and that will give us maybe an understanding, a better understanding of exactly why social distancing is important, and especially allow us to wrap our heads around that 14-day period. And so let me pull up this chart here. This is the chart for patient zero in the Sacramento area. So how did we get these figures? So as of Friday the 30th of March, we had in the Sacramento area 53 total reported cases. And so given that we have a doubling of the number of cases every 3 to 5 days, we're looking at approximately 5 infection cycles that are necessary to reach this, and that gives us about 25 days. And so that takes us back to February 24th, and that's why I've got that as an anchor number there. Now, this means that our patient zero was registered on that date, and at some point during those 2 weeks of recovery where they're presenting symptoms, that's obviously what made them then go to seek medical attention and then wind up getting tested and turning up positive. But The orange portion of the chart, that is the part where they were infecting people for 2 weeks before they even got to that point. And so that is the cautionary tale here, is that it's got that very long very long incubation period where you're not presenting any symptoms. And so that's what gives us that total 28-day cycle. And that also tells us why that 14 days is so important. We'll get to that as we kind of close out here. But so our patient 0 in this area, that puts them here again as early as February the 10th. When they might have actually caught it, again, assuming a kind of a worst case scenario where they caught the virus in, say, the Bay Area or the LA area, and then wound up coming here to deliver it. Now, the reason why I'm going to say that is possibly what happened here is because of a very unfortunate anchor that we have, and that is that the Sacramento area recorded its first fatality on March the 10th. And that was at a elderly care facility not too far from where I'm living right now. So that's interesting in that we kind of became the ground zero for this thing back for the Sacramento area. Now, the person that unfortunately succumbed to the virus was an elderly woman in her 90s. Now, obviously, she's not going to be traveling, right? And so that means that somebody who either worked at that facility or somebody who came to visit her wound up bringing the virus with her. And again, I don't know how long she suffered with that before actually presenting any symptoms, but we can kind of get an average idea there. And so then she was basically within that first or second round of replication of this virus. And so then that brings us again back around to Dr. Gatchet's concern and what she would like to see us following. By the time we are sitting here now at 53 total cases, all right, 6 of those cases have already recovered or so. All right? And so now we wind up with 53 cases we have. Roughly 6 have recovered, so we're in that kind of a 47 or so range of actual active cases. All right? And so that's now, or that was Friday. All right? What does that look like on Saturday, on Sunday, Monday? And so now what we're looking at is that you've already got this battery built up of replications. These people were already out there before we wound up doing the shelter in place, because we're talking about March 10th or so when the ball now is starting to roll. So what does that mean? What does that mean numerically? So here is what that full doubling really tells us. So this is where we are really sitting as of Friday the 20th of March. And again, my calculation is based on that rate of doubling and that unfortunate confirmation of our first fatality in that first round of recovery there. And we have a total number currently of infected of 500. 47 of those are actually currently presenting symptoms and have been registered as active cases, right? And so approximately 6 have recovered. Now, of that total of the 47 that are presenting, 5%, let's say 3 people or so, they're currently going to be requiring intensive care. And so then as we plug the numbers for the next 2-week period in, we get this. So now what we have is 2,000 active infectious people with no symptoms, 376 that are finally showing symptoms, and that's what we're going to wind up seeing this week. And then we have those initial 48 from the previous 2 weeks will have recovered and could be removed from that total number of active cases. And so those 376, 18 will require intensive care. And so that has already happened. It's not stoppable. Those cases, that's what we're going to wind up seeing. And so then obviously that's just short of what our saturation point is. So this is where we'll wind up seeing whether or not the social distancing has had an effect. What I'm hoping is that we wind up getting right to that peak, and then things will start to taper off as the number of cases dwindle. Now, we talked a little bit about the cycle time of 28 days and why that 14 number was really, really important as far as sheltering in place. So if you are not currently presenting any symptoms and you then go through that first 2-week cycle, right, you will start to present some symptoms. And obviously, if you are already presenting symptoms, if you already have then that 2 weeks will wind up getting you out of the point where you are still infectious and infecting others. So I'm going to go ahead and speak directly to the people that are currently not exhibiting any symptoms. Please, please don't go over to your friend's place because you've been practicing social distancing, you feel fine, and now you're going to go ahead and mingle with people that you already know aren't infected. Because this period of social distancing, this is for you. This is for you. This isn't for the people that are already presenting symptoms. They already know that they've got this. This is for you, the people who are not presenting the symptoms yet. So again, I'm sorry to keep repeating that, but that is why this is so very important. And again, I have to stress that we're not out of the woods on this. We are still going to see those 2,000 cases here in the Sacramento area when we are currently sitting at, I don't know. I haven't been watching the news the last day or so to find out what the actual reported numbers in the Sacramento area are. But we're going to wind up hitting that 2,000 figure. Where we go from there, that will depend on how we did with our social distancing. So my appeal to you guys, my mother is 88 years old. I'm a caregiver for her. Unfortunately, that means that I have to occasionally go to the supermarket and get her supplies. So obviously I have to be very careful when doing that. But folks, my heart goes out to all of you that are in similar situations to that. And please take this seriously. It's really important that we use these 2 weeks wisely. I know that it was a major pain for everybody. It's certainly been an eye-opener for me as well. But let's make sure that we do this for each other. And so with that, I wish you all of the best throughout this, and we'll try and get some other videos out here as well for your entertainment while we're all kind of here hanging out with each other. And we'll see you next time.